time for another episode of Let's Be Perfectly Queer with Randy Davis. We are back here again in Aurelia, Couchiching Family Health Team, talking again with our friends at the Trans Health Hub about all the struggles, hurdles, and successes that we see here in Aurelia for queer folks in Simcoe, Muskoka. So stay with us. Welcome to another episode of Let's Be Perfectly Queer with Randy Davis. We're back here at the Trans Health Hub in Aurelia at the Couchiching Family Health Services. And one of my guests this evening is Sarah Innes, who is a nurse practitioner here at the center. Welcome to the show, Sarah.
Oh, thank you.
Thanks for being with us today. So tell me a little bit about what it is that you do here at the Trans Hub.
So the team is comprised of a peer worker, a psychotherapist, and a nurse practitioner. So that's my role. I'm the nurse practitioner on the team.
And what does that role look like for you?
Yeah, it basically we see clients and kind of do a comprehensive assessment and then help them do a medical transition if that's their goal or if that's what they're looking for.
Okay. Can you be a little more specific for me and exactly, so you have someone who's looking to transition and they get to see you, and what does that interaction look like?
Usually there's a few visits where we kind of get to know each other, and it all kind of comprises like a standard assessment that is part of sort of like international guidelines around transgendered health.
Okay.
So we'll kind of do an assessment and then do a little bit of a physical assessment, get some blood work, just to make sure that people's metabolic markers are all kind of where they should be. Or where we would like them to be, and then we can help people kind of get started on hormones. So whether that's estrogen for trans women or testosterone for trans men, that's kind of the goal of the program.
Okay. And what got you into doing this sort of work?
Well, I've been a nurse practitioner for, I guess, just over 10 years now. And I have experience working at Sherburne Health Center, who've kind of been a leader in some of the trans health initiatives and have put together like an amazing resource, which is like the trans health guidelines that a lot of clinicians have been using for years. And so I had done work there, and about a quarter of my practice at that site had been trans women. And then I left that job to go and do a master's in gender studies at York University. Okay. And then I had proceeded to kind of do a little bit more mental health work, and then I was looking to move up to this area, and this job just kind of fell into my awareness. Yeah, I mean, it was like a perfect fit for me. So. And
so you've been here since the inception?
No, unfortunately, no. I started. I'm covering a parental leave, so I started in last. I guess it was last spring. Yeah, spring of 2019.
And what do you see as some of the challenges that folks, particularly in this area, face? We talked to Carl last week about accessibility of services and things like that. What do you see as some of the challenges for the trans folks that you see come through the doors?
I think, Carl had mentioned, lack of access to services, because a lot of people might have a primary health care provider, but that person may not be totally comfortable kind of getting people started on the medical side of the transition, so like starting hormones, monitoring hormones, doing the changes that have to be done to kind of help people meet their own goals for gender. And also, I mean, there's a huge issue with stigma, not just in North Simcoe and Muskoka, but in Ontario, in the world. Right. So I think kind of helping people navigate that. And also, we do a lot of work with like helping families kind of come to terms with what this means for them. I mean, it's not, every person we encounter is a member of a broader community. So if people need help kind of getting on side with the idea of transition, then we're very happy to do that with them.
Okay. And you mentioned previously that you did studies within this field as well, and can you just touch on that a little bit for me, and just some of your background and what makes you a good fit for? Oh,
it's like I have to do a job interview now.
Pretty much, yeah.
Yeah, I mean, so I did an MA in gender studies, but the goal of that program wasn't necessarily to prepare me for this work. I mean, that's not a clinical program. It's more of a theoretical kind of endeavor. So. But
that has to have prepared you for this work as well, right?
And I mean, of course, I've always been, an advocate for marginalized people and a feminist, and been always interested in LGBTQ issues. So, I think that again. I did that program more out of interest because it was just something that I really wanted to do some work that was more grounded in theory because I've been a clinician for so long. And I mean, it was lovely. Like I know it's a hugely privileged thing to be able to go back to school in your mid-40s, but like if you can do it, I highly recommend.
Yeah.
Yeah.
Well, and that's one of the things that I think is important about those of us who recognize our privilege to then, you know, again, recognize it, but then do something with it.
Oh,
you know?
sure, yeah.
It's one thing to say I'm a person of privilege and then, you know, just let it go. And that I think just shows even more of your privilege, especially, you know, white privilege.
Oh, 100%.
And certainly as a white cis man, I mean, I've got privilege, I'm dripping in privilege. And, and one of the things that allows me to sort of sit a little easier with that privilege is giving back and supporting the community and being an advocate and being able to speak up for those that for whatever reason either can't or won't speak up. So so I absolutely applaud you for that.
Oh, thank you. I mean, I wasn't looking for applause. It really was selfish, like because it was an enjoyable thing. And I mean, I love the work I do, so it's been great. But I think one thing about like the political environment now is that people are kind of more comfortable looking at privilege and thinking about privilege and kind of dissembling it and trying to analyze it a bit more. And like I think that's been so great, and I think that also really kind of helps our work too, because people are that sort of language is more in the cultural discourse.
Yes,
so you know,
recognizing it and learning how to sit with it and how to use that privilege. Right. So that's wonderful. So back to the Health Hub here and the work that you're doing. Patient-wise, can you give me an idea of sort of the makeup of what your patients look like here at the Health Hub?
The client base we have is, I would say the majority of people are sort of between 17 and 30, generally. There's a few other clients who are older than that, and we do get clients also who are younger, of course. I probably have like a 60-40 split between trans men and trans women, meaning I have a larger cohort of trans men in our program. But yeah, and I mean, you couldn't ask for a more engaged, motivated, like happy to show up to appointments, and like, you know, our clients are amazing and
I'm sure they're just so grateful to have you here.
I guess that's what it is. I mean, and selfishly, like it's just nice as a clinician to have clients who are so engaged in their care, because I think, you know, a lot of primary healthcare can be about things that people don't really want to deal with, like lifestyle changes, that whether it's things to do with hypertension or diabetes or all these kind of chronic health issues that aren't.
You need to change your diet, or you need to stop smoking, and
like our clients definitely. I mean, they're younger, so they don't have the burden of those later life diseases. But yeah, I mean, they're definitely motivated, and it's a lovely cohort to work with for sure.
Now, and I don't think the audience is maybe aware of what the population of trans folks look like in Simcoe Muskoka. There's quite a large number of folks who are who identify as transgendered or as transitioning within this catchment area. And why do you think that is? Why do you think there is such a large population of trans folks within Simcoe Muskoka?
I don't think it's a larger population than you would find elsewhere. Like I don't think there's a disproportionate number of trans people in this area. But I think, you know, nowadays people kind of have the language more for understanding, you know, perceptions they may have when they're younger that their body doesn't match their identity or things like that. Like transgender is more in the
popular vernacular now?
Yeah, it's more in the vernacular for sure. But I think like estimates really vary as to what proportion of the general population are transgender, but I think numbers are like typically quoted between like 1% and 5%. So when you think of like 5 in 100 people, I mean, you know, I probably passed 100 people going from home to work today. So, you know, you're going to encounter people might be surprised by those numbers, but
I guess it's my own view that's skewed too, given since I moved to the area 3 years ago, and the work that I have begun doing in my advocacy and activism and at the Gilbert Center. I guess maybe just my small world has expanded in the number of trans folks that I've had the pleasure of meeting and getting to know and become friends with. So again, that's my own view of the world has changed because I've been open to those experiences. So
yeah, for sure.
That's probably where that question comes from more than anything now that I really think about it. So. the services that you folks offer here, and I'm sure you obviously, I'm assuming you get together and consult as a team on patients as well, and get an idea of what their journey looks like and how to shape that. What does that process look like, and how do you feel your team works together as a team?
I think we definitely make a concerted effort to kind of check in with each other regularly. We have scheduled meetings weekly. We're scheduled to meet weekly. If it doesn't quite happen every week because of clinical responsibilities, we do our best. Right. But we try to like kind of scan all of our caseloads and see kind of where we can might be able to help each other out or like problem solve issues as they come up. But also, oh, sorry, I lost my train of thought.
That's okay. Wasn't a great question anyway. Of course you work well together as a team.
Right, No, we're great. I mean, we do have an informal system and a formal system of referring to each other, which we do a lot.
So it's not working in silos and then...
No, not at all, no.
And what do you say? I asked this question of Carl last week. What do you see as the hurdles that are still in place for folks transitioning, even in a system like this where you have all the sort of services combined under one roof to allow greater access? Yeah. What can still be done to make this easier?
I think like anyone who's gone through the system can tell you that the process of getting surgery done is like Byzantine and incredibly cumbersome, and you really need like a navigator to help you through that process. So I think there's been a lot of work done to kind of decentralize the access to surgery. So where Carl mentioned CAMH used to be kind of ground zero for getting the assessments done. Right. That's really been decentralized, which is great. It's increased access, but there's a ton of paperwork. Like it's almost, I find it overwhelming, so I don't know how clients deal with it. So I think people really need help with that. And it would be great if they could somehow centralize the surgical sites so that we knew where people had more likely to get access quickly, because we know that the waiting time is so long. Right. So if you knew that like the waiting time in Mississauga was had dipped a little bit, it would be nice to be able to funnel referrals where you knew people could get in quicker. Right. Because I think the time people wait is, it's huge, and just the bureaucratic piece. Yeah, and that wait time's got to be excruciating for someone who finally has the okay to go ahead with the surgery, and then to wait for up to a year or longer in some cases to have that happen. As I mentioned last week on the episode, I've seen the difference in folks from pre-surgery to post-surgery, and it truly is without a doubt life-changing. Yeah, people really do struggle with dysmorphia, so it's yeah. Sarah, appreciate your time with me tonight. I really am happy to have had you on the show this evening and hearing your experiences here in Aurelia, and I hope after the leave that you're replacing is over, that there's room for you here and you stick around. Oh, that'd be great. Yeah, I hope so too. Thanks, well, thank you very much. I appreciate it. Of course. Coming up next on the program, I'm going to be sitting with my lovely friend Charlotte Laws, who is also a member of the team here at the Health Hub. So stay tuned for that. We have my dear friend Charlotte Laws joining us for the second half of tonight's episode. Charlotte, welcome to the show. Hello. Pleasure. So your role here at the Trans Hub is what? Tell me what you do. So I am the mental health psychotherapist for the program. Okay. And what does your job look like here? What does that mean for folks at home that don't know what a psychotherapist does? So typically it's just providing support for mental health or addiction related issues for people who just need to access me because they're having difficulty with say family members coming to terms with their transition, or they themselves are sort of working through that process, because people don't realize there's a lot more to transition than just the physical aspects of it. There's the social aspects, and then also like the mental health aspects of it. I mean, there's a lot of discrimination and misunderstanding around what it means to be trans, so I just kind of help unpick that with them. Yeah, and as I mentioned, and we talked briefly with Carl last week and talked to Sarah just a few minutes ago, that mental health aspect, I think, is a piece that a lot of folks that aren't as closely associated with the transitioning journey are aware of or realize. Yes. They think it's just a matter of, I want to be a different sex. And that is just a very small portion of it. Can you touch on
the importance of mental health around transitioning, and certainly the stigma associated with it, and try and dispel some of those myths and misnomers that are out there, so that people can better understand what it means, and I hate to use the word struggle that folks transitioning go through, but those hurdles that we talk about so often that are put in front of people that don't have to be, and a lot of those hurdles stem from stigma. And how do you help folks navigate that?
Well, I think we all have sort of a dialogue, as we grow up, from society. And, so when I talk about people themselves having difficulty sort of coming to terms with who they are, that's, we call it internalized, transphobia or homophobia if it's related to sexuality. And, because we always get, what is the norm? How should we be normal?
Right.
And, that means that anything outside of that is seen as abnormal. And that's not the case. It's just there are differences. So a lot of people, there's a bit of a grieving process in terms of, they themselves sort of working out, this isn't who I thought I was. And there's a lot of myths around, how people now are getting information and if that's having an influence on who they are. I'm seeing a lot of younger people than I used to. And I think that's because obviously they've got access to social media and, the internet. And, there's that misconception that that's sort of causing people to be, become trans or, gay or whatever it is.
It's the stylish thing to do.
Exactly. And, and I mean, that's not the case. I mean, I have a lot of older clients who said, when they were growing up that they knew something was different. They knew that they didn't fit into this picture of, what we should be in terms of, the binary of male or female. And, just now they have language for it sooner than they did before.
Yeah, certainly. I mean, we never heard or nothing was ever explained of a gender spectrum when we were younger and growing up. So
exactly.
So I think that's an important aspect that folks of my vintage that only had that black and white binary to refer to, and not being able to, we younger folks now can see examples of folks living successful lives, transgender folks living successful lives as their authentic selves on TV and in television shows, and much like myself growing up, I never saw a gay man on TV that I thought would represent me, so I didn't know what that looked like or to be able to help me understand and define the feelings that I was having, and I'm sure that's a similar journey for trans folks. So
absolutely.
So how do you focus a little bit for me on the older folks that that you see and what their transition looks like, and being able to, having lived sort of in that body that isn't the body that feels right for them for so long, and to finally now be able to sort of recognize that this is my authentic self and this is what I need to do to be me.
Absolutely.
How do you help folks get through that aspect?
It's sort of a journey of self-discovery with the person, because I always think of the resiliency of the person, because like you said, they've been in this role so long and they've managed to get through to this point in their life, and it's been a real struggle for them, and to the confusion at times because they haven't had that language to understand what's happening and why they are the way they are. So just to be able to sort of validate, with them that, a lot of people in their position have been experiencing the same things, and also what does that look like now, because again, they're sort of feeling like they're behind, everybody else in terms of understanding. And again, another thing with the way we are as humans is we like to categorize and put people into neat little boxes, and it's just trying to go through with them that when we use the term trans, it doesn't mean you have to switch completely from one gender to the other.
Sure.
It can mean that you're gender diverse, you're more fluid in your gender expression and how you identify, and what does that look like for you. So is that just hormones? Is that hormones and top surgery?
Right.
I think there's a lot of misconceptions with the public that trans means that you have to have had all the hormone therapy, all the surgeries, and that's what makes you trans. But actually there's a lot, it's like everything else, there's a spectrum, and so trying to sort of help the person feel comfortable with where do they fit on that spectrum, and and what's going to make them happy, not everybody else.
Yeah, I'm glad you mentioned that, because you're right. That's when we talk about trans men and trans women, we have a tendency, or society does, of just creating a new box.
Absolutely.
We've taken out just the strict male-female binary, and now you're in this box of what society says a trans woman should look like, or what society says a trans man should look like.
Yeah.
And I think the more we talk about the spectrum and allowing folks to figure out where they fit along that spectrum, and that's where they fit, not where someone else tells you fit, but where you find your comfort level. That's what's important, helping folks recognize and accept that.
Absolutely.
Because I think that's probably, and correct me if I'm wrong, that's probably part of the struggle and the process within someone who's transitioning to determine for themselves where sort of that where they sit on the spectrum, because they have also been preconditioned that I have decided I need to transition. I'm a trans woman, and this is what that is supposed to look like. But for me, it doesn't feel that way, and that's got to be a struggle. And I can only imagine some of the conversations and the emotions that come along with that.
Well, and you've got family members that you have to come out to, and and everybody else that you have to come out to. And again, it depends on where you are in your journey, because if you're at the beginning, there's a lot of people getting misgendered continuously, or people not respecting pronouns, and then you add in sexuality to it as well. I have a lot of trans clients who people think, oh well, you transitioned to a man, so that means you must be interested in women.
Right.
But that isn't the case. Sexuality and gender are very different things.
Absolutely.
But you get that kind of double whammy of stigma that goes along with that, and it's more complex than people give it credit. So we have to unpick a lot of different things.
So when you, and maybe you don't, but when you do speak to folks that aren't as familiar with the process of transitioning, or have had the exposure to trans folks, and be able to actually get to know someone who's transitioning or who has transitioned, how do you talk to folks, particularly maybe my audience, who are, again, as I mentioned when I was speaking with Kyle, I'm trying to get this message out to the white cisgendered folks out there that just don't have a concept of what this looks like. What do you say to folks to help them to better understand? And certainly you touched on pronouns, and that was a big thing for myself, even. Recently moving here to Barrie, and when I started my role at the Gilbert Center, and making sure that when I go out and speak, I introduce and tell folks my pronouns right away, and it's on my business card, and that sort of thing. And how do you convince the cisgendered population out there that this is the language you need to be using, this is the approach that you should be taking, and this is how you can use your privilege to help trans folks? Well,
I talk about this kind of thing from a very privileged perspective, because I am cisgendered, and I'm obviously like a white woman, which it brings with it a lot of it. But I've seen a lot of different approaches to it, and I think convincing is an interesting word, because I've seen lots of different ways, but my general way is just to try and give an approachable way of people coming and accessing me. So in my workplace, there's people that want to help, and they want to do things in the proper way, and use the right pronouns and that, but there's a lot of because they're not sure and they don't want to offend people, that confusion. I feel like I just want to be accessible to people, and of course there are going to be mistakes that are made in the beginning, and so it's about making that clear to people that there's a difference between doing something purposefully, continuously, like using the wrong pronouns, and actually just saying there's going to be mistakes in the beginning, and that people that you're going to see who are trans, they just want to see that you're trying, and that you're open, and that you're validating, because like Sarah was mentioning with you before, we get a lot of clients who are just very grateful to have access to people who they feel safe with.
Sure.
And that's the big piece. You can't completely make everything safe, but we can be open to learning, and open to learning new language and ways of being, and open-mindedness is a big thing. So if anyone ever has any questions, or I do talks at work, anyone who wants to ask questions, I'm more than happy to talk to them, because I think that's how you promote understanding and, you know, educating people, and I guess convincing them that there's more than one way to be.
Yeah,
you know?
yeah, and I agree. I think that's incredibly important. I think we would have a much happier world if people concentrated more on their own internal happiness and not worrying about having to put other people in a box or defining them. Let us define ourselves, and then like me is who I am, or don't. That's your choice as well. But don't try and change me to be something that you think I should be.
Exactly.
So, what about the hurdles that we talked about already, and what more needs to be done within trans health from your perspective to be able to? We talk about with Sarah about the length of time between getting the authorization to surgery and then having to wait so long, and so we know wait times are obviously an issue. Do you see anything else as a major issue for the trans community, and how the general public can maybe help overcome some of that?
I think education, you know, I'll go back to that again. It's just, you know, there's lack of understanding because of lack of education, and, you know, like there's a lot of myths around things, and, you know, when you look at day-to-day living, even, you know, washrooms, for instance, I mean, they are such a huge barrier for people, you know, and the anxiety that it provokes in people, you know, there's sort of myths around, you know, a trans, you know, woman using a washroom, you know, and it's like, trust me, they are more worried about it than anybody else is,
100%,
you know?
sure.
But, you know, again, there's misinformation and misunderstanding, and just making things more accessible, and trying to sort of think outside the box a little bit, because yes, for you know, you and me, it might be, yes, I'm, you know, ticking that box saying I'm a man or a woman, but, you know, that doesn't mean that's the case for everybody. So just, you know, building that awareness that, you know, there's more than two boxes.
Yeah, accessible washrooms, intake forms, those sort of things that most of us take for granted, and can be very triggering for some. And it seems, and I'm glad you brought that up, because it seems ridiculous to me that something as simple as a washroom. I mean, just
we take it for granted.
Just make it accessible. You know, it boggles my mind. And I think we often say this when we talk about this subject is, you know, the washrooms in our homes are fully accessible. So what's the issue with public washrooms being fully accessible?
Absolutely. And I think it's more about as well services. You know, I started this work because, you know, I have been to professionals that haven't always been that open-minded, should I say. But, you know, having those people that you know in the community are accessible and safe, you know, is a huge thing, because people aren't accessing services because they're afraid to access medical services or counseling services. So, you know, I'm, you know, one person, but I know there are other people out there that are willing and you know, happy and wanting to help populations, but how do we know who those people are? And it's just maybe networking more with each
recognizing
other.
those allies. And
absolutely.
For sure. Charlotte, it's been a pleasure.
Yeah, thank you.
It's a treat to have you on the show. Just listening to your accent alone is enough for me. But you already knew that. But so thank you again for being with me tonight. My thanks to Sarah for being on the show earlier as well. Really appreciate being able to get this information out to the public, and as you pointed out, hopefully educating some people out there. And if you have any questions or concerns or comments, by all means, reach out to me on our social media pages. I can forward all the information to you from the folks, not only Carl, but Sarah and Charlotte here at the health team in Aurelia. And again,